RBT CA online practice. Question 1. What are the functions of behavior? Option A: escape, attention, tangible, sensory. Option B: compliance, aggression, happiness, attention. Option C: escape, mood, hunger, sleep. Option D is sensory, emotion, social, escape. The correct answer is option A: escape, attention, tangible, sensory. The four functions of behavior are sensory, escape, attention, and tangible, seat. Question 2. What signals the availability of reinforcement? Option A: SD, discriminative stimuli. Option B: S delta. Option C: motivating operation. Option D: consequence. The correct answer is option A: SD, discriminative stimuli. A discriminative stimulus, SD, is a stimulus in the presence of which a particular response will be reinforced. Question 3. This consequence increases the future likelihood of behavior. Option A: reinforcement. Option B: punishment. Option C: extinction. Option D: prompting. The correct answer is option A: reinforcement. Reinforcement always increases the future frequency or likelihood of a behavior. Question 4. Reinforcement is delivered, on average, every 2 minutes following the first response after the time is up. What reinforcement schedule is this? Option A: 6-2, variable interval. Option B: phi2, fixed interval. Option C: VR2, variable ratio. Option D: FR2, fixed ratio. The correct answer is option A: 6-2, variable interval. Variable interval, 6, means reinforcement is delivered after an unpredictable amount of time has passed. Question 5. This procedure involves reinforcing gradual changes in behavior. Option A: shaping. Option B: chaining. Option C: fading. Option D: generalization. The correct answer is option A: shaping. Shaping is the process of differentially reinforcing successive approximations to a terminal behavior. Question 6. The first step in this prompting strategy is errorless learning. Option A: most to least prompting. Option B: least to most prompting. Option C: graduated guidance. Option D: time delay. The correct answer is option A: most to least prompting. Most to least prompting begins with the most intrusive prompt to ensure the student responds correctly, errorless learning. Question 7. Which of the following is the best example of maintaining client dignity? Option A: not restricting clients' right to food or water. Option B: sharing clients' private info with other RBTs. Option C: explaining to a waitress that your client has autism. Option D: sharing client info with a peer. The correct answer is option A: not restricting clients' right to food or water. Maintaining dignity includes respecting basic rights and privacy, and not treating the individual differently because of their disability. Question 8. What do you need to do to be sure you are ready to have a successful session? Option A: you know what you are measuring and have the materials required before starting. Option B: arrive exactly on time and wait for instructions. Option C: check your personal emails for updates. Option D: ask the parent for the daily plan. The correct answer is option A: know what you are measuring and have the materials required before starting. Being prepared involves reviewing the session notes, knowing the targets, and having all data collection tools ready. Question 9. A little boy plays with his toy zebra. Holding it, he says, "Zebra." What type of verbal behavior is this? Option A: tact. Option B: mand. Option C: echoic. Option D: intraverbal. The correct answer is option A: tact. A tact is a verbal operant where the speaker names things or actions that they have direct contact with through any of the senses. Question 10. When working with a client, whose preferences should take priority? Option A: the client. Option B: the BCBA. Option C: the parent. Option D: the RBT. The correct answer is option A: the client. The client's preferences and autonomy should be the primary focus whenever possible. Question 11. Adding something that will motivate a person to increase the likelihood they engage in the target behavior again is what type of reinforcement? Option A, positive reinforcement. Option B, negative reinforcement. Option C, positive punishment. Option D, negative punishment. The correct answer is option A, positive reinforcement. Positive reinforcement involves adding a stimulus following a behavior that increases the future frequency of that behavior. Question 12. What occurs before a behavior? Option A, antecedent. Option B, consequence. Option C, a response. Option D, reinforcer. The correct answer is option A, antecedent. An antecedent is a stimulus or event that happens immediately before a behavior occurs. Question 13. Which antecedent increases or decreases the value of a consequence? Option A, a motivating operation. Option B, a discriminative stimulus, SD. Option C, a response. Option D, consequence. The correct answer is option A, motivating operation. A motivating operation, MO, alters the effectiveness of a reinforcer and the frequency of behavior associated with it. Question 14. You are recording the time it takes from the presentation of the demand, SD, to the first instance of behavior. What are you measuring? Option A, latency. Option B, duration. Option C, frequency. Option D, interresponse time. The correct answer is option A, latency. Latency is the measure of the elapsed time between the onset of a stimulus and the initiation of a response. Question 15. All of the following are acceptable for a professional relationship between an RBT and supervising BCBA except Option A. The RBT implements the treatment plan as directed no matter what. Option B. The RBT contributes ideas and input about the shared client. Option C. The BCBA provides feedback to the RBT about performance. Option D. The BCBA requests the RBT assist in parent training. The correct answer is option A. The RBT implements the treatment plan as directed no matter what. RBTs should follow plans but also communicate if something is unethical or not working, no matter what ignores professional judgment and ethics. Question 16. This is the breakdown of a task into its individual components and steps. Option A, task analysis. Option B, shaping. Option C, chaining. Option D, fading. The correct answer is option A, task analysis. Task analysis is the process of breaking a complex skill into smaller, teachable steps. Question 17. Frequency and rate are often used interchangeably. What is the difference? Option A, rate refers to frequency with the addition of time, rate equals frequency/time. Option B, a frequency includes time and rate is just a count. Option C, rate is for duration and frequency is for count. Option D, there is no actual difference between the two. The correct answer is option A. Rate refers to frequency with the addition of time, rate equals frequency/time. Rate is a ratio of count per unit of time. Question 18. The most common form of graph used in applied behavior analysis, ABA, is Option A, line graph. Option B, bar graph. Option C, pie chart. Option D, scatter plot. The correct answer is option A, line graph. The line graph is the most common way to display data over time in ABA. Question 19. A client consistently engages in verbal stereotypy. You are instructed to reinforce the client whenever they are not engaged in verbal stereotypy. What type of differential reinforcement is this? Option A, DRO, differential reinforcement of other behavior. Option B, DRA, differential reinforcement of alternative behavior. Option C, DRI, differential reinforcement of incompatible behavior. Option D, DRL, differential reinforcement of low rates. The correct answer is option A, DRO, differential reinforcement of other behavior. DRO involves providing reinforcement for the absence of a problem behavior during a specific time interval. Question 20. Which of the following is the best way to communicate treatment progress with the client's parent? Option A. Today we worked on brushing teeth. She successfully applied toothpaste and brushed for 30 seconds. Option B. We changed the reinforcement schedule from FR5 to VR3 today. Option C. We probed out hand washing in the BCBA will analyze the task. Option D. The client's behavior was really bad today and the plan isn't working. The correct answer is option A. Today we worked on brushing teeth. She successfully applied toothpaste and brushed for 30 seconds. Communication with parents should be clear, professional, objective, and use non-technical language. Question 21. You say light on in a closet and then your toddler says light on. Your toddler engaged in what behavior relative to your verbal behavior? Option A. Imitation. Option B. Echoic. Option C. Tact. Option D. Mand. The correct answer is option A. Imitation. In this context, the toddler is repeating the vocalization, which is an echoic, or imitation of the verbal model. Question 22. You want to make it harder for your client to earn reinforcement as they progress. Which schedule would be the worst to use for this objective? Option A. A continuous schedule, FR1. Option B. Fixed ratio schedule. Option C. A variable ratio schedule. Option D. A variable interval schedule. The correct answer is option A. Continuous schedule, FR1. A continuous schedule provides reinforcement for every single response, making it the easiest to earn and the opposite of thinning a schedule. Question 23. Gabe jumps into freezing water and immediately runs to the shower. He never jumps in freezing water again. The freezing cold is A. Option A. Unconditioned punishment. Option B. Conditioned punishment. Option C. Negative reinforcement. Option D. Positive reinforcement. The correct answer is option A. Unconditioned punishment. Unconditioned punishers are stimuli that are punishing without prior learning, example, extreme temperatures or pain. Question 24. Which of the following is not an essential component of a written skill acquisition plan? Option A. Review data on average once every 2 months. Option B. Identify a skill to teach and create a goal. Option C. Modify the plan if necessary. Option D. Identify a measurement procedure for data collection. The correct answer is option A. Review data on average once every 2 months. Data should be reviewed much more frequently than every 2 months to ensure the intervention is effective. Question 25. A child learned to tie their shoes months ago and can still do it independently without recent practice. What does this demonstrate? Option A. Maintenance. Option B. Generalization. Option C. Acquisition. Option D. Fluency. The correct answer is option A. Maintenance. Maintenance is the ability to perform a learned skill after formal instruction has ended. Question 26. To determine how many times a student raises their hand, which measurement method should be used? Option A. Frequency. Option B. Duration. Option C. Latency. Option D. Interresponse time. The correct answer is option A. Frequency. Frequency, or count, is used to track how many times a discrete behavior occurs. Question 27. Miranda wants to measure the amount of time that passes between the occurrences of her client asking for a break. What data should be collected? Option A. Interresponse time, IRT. Option B. Latency. Option C. Duration. Option D. Rate. The correct answer is option A. Interresponse time, IRT. Interresponse time is the elapsed time between 2 successive responses of the same behavior category. Question 28. What are examples of a response prompt? Option A. Model, verbal, and full physical. Option B. A stimulus fading and gestural. Option C. Positional and redundancy. Option D. Time delay and maintenance. The correct answer is option A. Model, verbal, and full physical. Response prompts act on the behavior itself and include modeling, verbal instructions, and physical guidance. Question 29. Which of the following would be best at tracking frequency? Option A. Clicker. Option B. Stopwatch. Option C, wristwatch. Option D, measuring tape. The correct answer is option A, clicker. A clicker, or tally counter, is a common and efficient tool for tracking frequency of behavior. Question 30. You are recording how long it takes your client to get dressed in the morning. What type of data are you taking? Option A, duration. Option B, latency. Option C, frequency. Option D, rate. The correct answer is option A, duration. Duration is the measure of the total extent of time in which a behavior occurs. Question 31. An RBT presents all toys at once, allows the child to pick one, then removes that toy and repeats the process. Which assessment is this? Option A, MSWO, multiple stimulus without replacement. Option B, MSW, multiple stimulus with replacement. Option C, paired choice preference assessment. Option D, a free operant observation. The correct answer is option A, MSWO, multiple stimulus without replacement. In MSWO, the selected item is not replaced, and the remaining items are rearranged for the next trial. Question 32. A mother reviews a grocery list to check if her daughter bought all the items. What data collection method is being used? Option A, permanent product. Option B, event recording. Option C, interval recording. Option D, a momentary time sampling. The correct answer is option A, permanent product. Permanent product recording measures the outcome or result of a behavior rather than the behavior itself. Question 33. Which assessment would be most appropriate for a client who demonstrates a side bias? Option A, a single stimulus preference assessment. Option B, paired choice preference assessment. Option C, MSWO. Option D, a free operant observation. The correct answer is option A, single stimulus preference assessment. Single stimulus, successive choice, presents one item at a time, which bypasses issues like side bias where a child always picks the item on the left or right. Question 34. What is your role as an RBT during a functional assessment? Option A, to assist with the assessment. Option B, to design the functional assessment. Option C, to lead the functional assessment. Option D, to analyze the results and write the report. The correct answer is option A, to assist with the assessment. The RBT's role is to assist the BCBA by collecting data and helping implement assessment procedures.